Every day, millions of people take medications to manage health conditions, often without thinking twice about what they eat or drink alongside them. But did you know that some common foods and beverages can interact dangerously with certain medicines? Today, let's explore 5 surprising food-drug interactions, understand why they matter, and learn how to keep ourselves and our loved ones safe. First, what are food-drug interactions? Simply put, these occur when what you eat or drink affects the way a medication works in your body. Sometimes food can block a drug's effectiveness. Other times, it can intensify side effects or even cause new problems. According to research from Harvard University and the University of California, Berkeley, understanding these interactions isn't just for pharmacists, it's vital for everyone who wants to stay healthy. Let's dive into our first example: milk and antibiotics. You might believe a glass of milk is always a healthy choice, but when it comes to certain antibiotics, like tetracycline or ciprofloxacin, dairy can actually block your medicine from working. Here's why. Calcium in milk binds to the antibiotic in your stomach, forming a compound your body can't absorb. The result? The infection might linger longer than it should. The solution is simple. Take these antibiotics with water and wait at least 2 hours before enjoying dairy products. Now, let's look at another common duo: grapefruit and statin medications. Grapefruit is praised as a superfood, packed with vitamin C and antioxidants. But if you're taking cholesterol-lowering drugs called statins, this fruit can be risky. Compounds in grapefruit block an enzyme in your liver that helps break down statins. This can lead to dangerously high levels of the drug in your bloodstream, increasing the risk of muscle pain, liver damage, and other side effects. The safest move? If you're on statins, skip grapefruit and opt for other fruits like oranges or apples. Our third example involves alcohol and painkillers. After a long day, a glass of wine may sound relaxing, but mixing alcohol with over-the-counter pain medications like acetaminophen or prescription opioids is a recipe for trouble. Alcohol and these drugs both tax your liver, and together they can increase the risk of liver damage or stomach bleeding. For opioid medications, alcohol can slow your breathing to dangerous levels. The bottom line? Never mix alcohol with pain relievers. Always follow your doctor's instructions. Let's turn to a daily pick-me-up: coffee. If you have asthma and use bronchodilator medications like theophylline, coffee can amplify the drug's side effects. Both coffee and theophylline stimulate your central nervous system, leading to jitters, insomnia, or even a racing heartbeat. According to studies from Cornell University, it's best to limit coffee and other caffeinated drinks while taking asthma medications. If you notice side effects, talk to your doctor about adjusting your caffeine intake. Finally, consider leafy greens high in vitamin K, like spinach, kale, and broccoli. If you're taking the blood thinner warfarin, vitamin K helps your blood clot, but warfarin works by slowing that process. Eating large amounts of vitamin K-rich foods can reduce the effectiveness of your medication, increasing the risk of dangerous blood clots. The key isn't to avoid these healthy foods altogether, but to keep your intake consistent from week to week. Always let your healthcare provider know about your diet. In summary, food-drug interactions are more common than you think, and being aware is the first step to prevention. Read medication labels carefully, ask your pharmacist about potential interactions, and keep your healthcare provider informed about your diet and habits. By making smart choices every day, you can protect your health, avoid side effects, and get the most benefit from your medications. Share this video to help your loved ones avoid dangerous mistakes when taking medication. Hit follow to stay updated with more health videos.